And hello, I'm Eric Shaw. Time now for Sunday House Call.
Hello, everyone. I'm Marthel Neville. Welcome. Joining us, Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
And Dr. Marc Siegel, Professor of Medicine at NYU's Langone Medical Center, is also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. And that's what we're going to do here today, as we do every Sunday.
Good to see you.
Hi, doctors. Okay, we're going to start with this. There is a disturbing outbreak of Legionnaires' disease after it killed 10 people and more than 100 others are injured or diagnosed with this disease. First of all, Dr. Samadi, what is Legionnaires' disease and how do you contract it?
Arthel, this is a bacterial pneumonia. This is a kind of bacteria that we know about this for about 40 years. It was discovered in 1976 after the American Legion Convention. There was a big outbreak of pneumonia, and that's where the name comes from. Over the last 40 years, it hasn't done much. We see about 8,000 of these cases a year. It doesn't really kill too many people, maybe about 10%. It's not a lethal weapon, but the concern here is that you have an outbreak of this bacteria in South Bronx, and all of a sudden when you see 10 people die, 100 people are going to the ER, this is a huge concern. It's a kind of bacterial pneumonia that you don't get from person to person. It comes from the air conditioning towels and also from the mist and in the water. That's where you would get this. Usually the incubation period is about 2 to 10 days. I don't want people to be really nervous or panic about this. Even though Mary Bassett called this one of the biggest outbreaks, the numbers are declining and we're catching them early. The key is to diagnosis early with signs of fever, chills. A lot of us may get this, and Marc will make more comments about this. When you get the fever, it's called Pontiac fever. But since you're not immunocompromised, your body will fight back. But immunocompromised, COPD, smokers, children, elderly, those are the ones that need to diagnose early and treat it early.
Yeah, but how do I know I just don't need to run to CVS and get something for a fever?
Well, you know, you don't, but you're bringing already, Arthel, up a point that is really important to me when I see this, which is I never know if I'm seeing it. If I see somebody get really sick, and we have a list of some of the early symptoms you might see, you have muscle pain, you have weakness, you have fatigue, you have loss of appetite, headache, fever, dry cough, chills. Guess what? That sounds like almost any pneumonia that you could have. Then suddenly you have pneumonia and you have cough and very, very high fever. Well, we have to treat that. We have to treat that thinking it could be Legionnaire's disease. So that's what we end up doing in the hospital. Someone comes in with an unknown pneumonia, we treat it. And we treat it and we cover with antibiotics that would cover this. But to David's point, and this is really important, people out there in Oklahoma, you're not going to get this. People in Iowa, you're not going to get this because it does not spread person to person. It only spreads in air conditioner vents. There's some cooling towers in the South Bronx that are infested with this. They're having trouble killing the bacteria in there. They're trying heat. They're trying chlorine. They're trying everything they can. But unless they eradicate it, someone's going to breathe it in. And as David's point, somebody with emphysema, somebody that's a smoker, somebody that's run down with diabetes are at great risks for getting very sick.
What to me is so alarming about this is we remember what happened in Philadelphia, the Bellevue Stratford Hotel. That was in 1976. 34 people died. But look at the list. Netherlands, 32 people in 1999. 21 people died at a nursing home in Canada in 2005. In Chicago, at a JW Marriott Hotel, 2 people died in 2012. And in Cleveland, 2 days ago, a woman's being diagnosed who died in a hospital. And in Chicago last month. So this is around. So I mean, how do you stop it? And is it just a matter of disinfecting these cooling towers? You would think that after what happened in 76, they would know how to stop it.
It's an excellent question, Eric. And we should have learned from a lot of these lessons, meaning that you have to know where these cooling towers are. And guess how we found out where these towers are? We use Google Map. We use Google Earth Map to find out where these cooling towers are. 30% of them are infected in South Bronx. And I'm glad that Mayor de Blasio and Governor Cuomo are sending the inspectors. And now it's a mandatory to look at all of these cooling towers to find out where these bacteria
Did the state do that before? Health department do the little test in the water and make sure that Legionnaires isn't in there.
Because it is in the water. The number one place for it is in potable water. And, you know, I want to put it this way. This may answer your point, Eric, about how it's all over the country, because we see close to 50,000 cases a year, 25 to 50,000 cases. Why? The answer is, think of it how flu lives in people. This stuff lives in air conditioners. So it's hard to know if your air conditioner has it. It's hard to know if your cooling system has it. They should be checking for it all the time. We're not checking for it enough.
So, Dr. Siegel, is it kind of like mold can get into places where there's water? And I mean,
That's a good way to look at it. It's a bacteria. It's not a mold, and it's treated with a regular garden variety antibiotic like erythromycin or levaquin or ciprofloxacin. These are common antibiotics that people out there know about. That treats this. But it's a bacteria, but it kind of hides in the cooling systems, and it's very, very hard to get out.
I think the biggest news for a lot of people out there is not to ignore the symptoms and not just to wait until it gets too late. When you diagnose this early, and the message to a lot of doctors is right now, any kind of pneumonia symptoms in the Bronx is Legionnaires until proven otherwise, and you don't treat it with the same old-fashioned penicillin. A lot of times Cipro or Levaquin or other type of antibiotics can knock this out, and patients do very well. Everybody is on alert. Nothing to panic. This is probably going to phase out, but there's a lot of lesson to be learned from this, so in the future we won't have a problem.
I may not see it on a chest x-ray. That's another problem. I look, I may not see it. I got to treat it, like David just says, just in case.
Can it be in your home cooling system?
Yes, that's absolutely.
Unlikely, but possible.
Okay. Yes, it can.
Well, you know, talk to your landlord. If you live in an office building or a mall or wherever you go, make sure, ask them, are they testing? Right?
Yeah.
That could stop it.